The minute he got a little bit of a swallow, they sent him to Prince Henry Hospital for rehab. He spent 4 months, 3.5 months there, and then they said they couldn't do any more for him. It was 4 weeks, he'd plateaued out, 4 months, he'd plateaued out, and they were going to discharge him to a nursing home. I was 51, he was 54.
So absolutely, the hospital will help you arrange residential aged care. Hospital staff know that it's a really difficult time and it's quite a complex process, so they'll do everything they can to make it as easy as possible. Normally the process will start if the treating team thinks that residential aged care is an option, then they'll have a family meeting, and that's an opportunity really to have a look at what's happened and what the person's care needs are, and to basically meet together to work out if residential aged care is going to be the best possible option for that person. From there, they will arrange the aged care assessment team's assessment, which determines your eligibility for residential aged care, and they'll help you every step of the way through the process. The family members will still need to visit aged care homes and make a decision about which home they want to waitlist their relative at. I think sometimes it happens very suddenly, and also we all have an expectation and a wish that we'll see our lives out at home. So it is a really emotional time and it's a very difficult time, and sometimes that can mean that there's some differences of opinion as well that need to be worked through. So sometimes the treating team has an idea about what they recommend, and the family may think differently, and there may also be differences of opinion within the family themselves. So hospital social workers are really adept at working out how to make that process as easy as possible for everyone. But a lot of people also make this decision from home, so they may have been discharged home after the stroke, and as they age, they decide at a particular time that it's something that they need to look at, and there's an enormous amount of support available in the community as well. The Australian Government has a service called My Aged Care, and it's brought together all of the services and expertise around residential aged care, makes it really easy. They've got a one-stop shop that people can get all the advice and support they need. So the aged care assessment team is a multidisciplinary team. There's medical staff, nurses and allied health staff, and they operate in every area in Australia, and they are basically the only service that can determine eligibility for aged care homes. So they will do the assessment and complete all the paperwork, and that will basically make the person formally eligible, and it will also describe their care needs in some detail, so that when the families go out to visit aged care homes, they've got some documentation that shows exactly what their relative would need. All aged care homes are different, and they all have a different environment, a different culture and a different history. So it's really important to find the right one, and that's a big challenge for families as they go through this process. From there, it's really about visiting quite a few, so you get a sense of the different ones that are available. Once you're visiting, there's 3 things to look for. Location is really important, thinking about who will be visiting on a regular basis and making sure it's not going to be overly burdensome to them to visit. From there, have a look at the building, just making sure that it's a pleasant environment and that it's well maintained. The care can be a little bit harder to judge, but you will notice a lot of things when you visit around how you're treated as a visitor, how your questions are answered, and what you observe about the care that's being provided to residents while you're there as well. It can be a little bit overwhelming, and that's why we've created, at the National Stroke Foundation, we've created a really quick and easy checklist that's available on Enable Me that people can look at, and it's basically got the basic questions that you could ask and room to tick or to cross if the home that you're visiting meets your standards or not. So that's a good tool to use as you go through and visit, just to weigh them up and make a decision.